Hello and welcome to your next Menopause Morning, where today we're going to talk about how menopause affects the health of your bones, the health of your muscles, and then also the health of your connective tissue. And I'll tell you right off the bat, I mean, I see this all the time. Where you could be one of these women, you enter into menopause and all of a sudden you're told by your doctor you've got osteoporosis or osteopenia. You've gotten your bones scanned back and there's less density in your bones, or maybe it's not a skeletal issue. Maybe you just recognize that, when you go and work out, you just don't recover like you used to. Your muscles are sore for days instead of a quicker recovery. And you're not even getting the gains in the gym that you used to, or maybe even recognize that you're just getting hurt more often. Maybe if you're into any kind of recreational sport or even just in your own fitness routine, you're recognizing that seems like your ligaments and your connective tissue just aren't what they used to be. You're getting more sprained ankles, you're spraining your knee, you're having all these different issues that you never really did before. Now, what I want you to recognize with this is tied into the same thing that would cause any other what you know of as a menopause symptom. You've heard me say this many times. If you watch the Menopause Morning with any regularity, you get this, is that, the recognition that about 2 million women in the US enter menopause every year. And about 15% of those women, they only have two symptoms. The symptoms are that they no longer have a monthly cycle and they can't conceive. And, I've been working with menopausal women for a heck over 25 and a half years. And, to recognize that most women are pretty excited about that. When you make that transition from childbearing years into perimenopause and menopause and postmenopausal, and you no longer have a monthly cycle and you can't conceive, that's not a bad thing for most women. Now, the problem though is that that's 15%. Well, the other 85%, which is most likely you if you're watching this video, are having much more significant issues with menopause than the two true symptoms of menopause. You might be dealing with some of the common symptoms that you have been really told are menopause symptoms, such as weight gain, mood swings, sleeplessness, hot flashes, brain fog, fatigue, the list goes on. But what I want you to recognize is that if you're having any of those symptoms, it's really not what is referred to as menopause. It's going through menopause with a hormonal system that is no longer in optimal vitality. You see, because your body is already designed to perfectly transition from childbearing years into perimenopause, menopause, and postmenopausal, really without any snag, without any hiccups, without any suffering, which you may be dealing with today. Now, outside of those symptoms, I want you to recognize that keeping your body symptom free from menopause, short of, again, you don't have a monthly cycle and you can't conceive, but keeping your body free of any symptoms is really tied into how your brain, your hypothalamus, and your pituitary all work synergistically together. When that system's working well, you don't have those symptoms. When that system is not working well, you could suffer from any of the symptoms that you've been known and been told to be menopause symptoms. But there's more than just that. And what I want to do is I want to show you kind of a recognition of what else could be going on outside of just what you think of as menopause. Now, everything on this slide is tied into an HPA axis dysfunction. Remember, I just mentioned it's really menopause symptoms are really just a lack of vitality in how your brain, your hypothalamus, your pituitary, and your adrenals all work together. And that's referred to as the HPA axis. That's hypothalamus, pituitary, and adrenal. Now, all of these could be potentially symptoms that you're dealing with. But the one I want to focus on today is all the way on the left of this slide. And that's where it says musculoskeletal health. Now, what you see underneath that is it mentions muscular integrity, bone turnover, and also connective tissue turnover. Now, what most don't really recognize is that this is tied into, again, that HPA axis that's not working as you enter into menopause. And as I mentioned, I see this all the time. I see this with women who, again, their doctor had told them they're either diagnosed with osteopenia or osteoporosis. They've gotten their bone scan back, and the density in their bone is much lower. And typically, you're told you just have to go on something, some kind of prescription drug to help save your bones, or there's just a number of different options that really still don't fix the problem. Because let's recall that the problem is how your brain, your hypothalamus, your pituitary, and adrenals are probably not working really in the optimal level that you need them to. Now, the problem with this is that, number one, your hormonal system plays a significant role in the health of your bones. This is the first thing I'll focus on. And I want you to recognize that your bones are like living, breathing things. Your bone creates what's known as osteoblasts and osteoclasts. So that's your bone's ability to break down bone and to rebuild bone. And when your HPA axis is working well, you're still doing that on a regular basis. But the problem is that when your hormones are really out of balance because your brain and your HPA axis are not working well, the osteoblasts and osteoclasts aren't going to do the job as they did when you were younger. And another problem I see is women dealing with muscle and also connective tissue issues. And from the muscular perspective, some of the common problems I see is that, as a woman, maybe you've already had a fitness routine, you've been going to the gym for maybe years or decades already, but now all of a sudden, postmenopausally, when you go to the gym, maybe you're not getting the gains that you used to in the past. Maybe you still feel like you're getting the gains, but man, the recovery is much more difficult than it was in the past. Maybe in the past you'd have a good workout, you'd be sore for a day, then you'd have a full recovery, you get back to the gym and you're feeling good again. But now you're recognizing that recovery might take you 2, 3 days or more. And this is because of how the whole of this HP axis is affecting what's going on with your muscular tissue. And now the other problem that I see caught on a significant basis is women who are just constantly getting injured. Where whether you're doing your recreational sport or your fitness routine, and you're just recognizing, you might even think that all of a sudden you've gotten clumsy, where you're thinking that, oh, I keep spraining my ankle or I'm twisting my knee and I'm having all these problems. Well, when you think of all of your connective tissue and these ligaments that are really kind of holding everything together for you around your joints, when the HPA axis is not working well, when your hormonal system is off, it's also having a negative impact on that connective tissue, on those ligaments. And it's not that you're all of a sudden becoming, klutzy or, something like that. It's just that in the past, when you would have maybe a slight little strain on something, there was strength there and you wouldn't have the same problem that you're having now. But what I really want you to recognize with everything we're talking about here, about your bone turnover, about your muscular health, with your connective tissue turnover, it's all tied into the simple fact that your brain, your hypothalamus, your pituitary, and your adrenals are lacking vitality. And this is what's also driving any other symptom that you refer to as a menopause symptom. And let's remember, the only two true symptoms of menopause are you stop having a monthly cycle and you can't conceive, and that's it. So the big question, that you have to kind of ask yourself is, you know, what do I want to do about this? Do I want to continue to go down a path of my skeletal system breaking down on a consistent basis? Or am I going to use some prescription drugs that kind of lock up my bone, like where you don't even have the ability to build more bone on a regular basis? Or do you want to just keep kind of suffering with what you're doing in the gym and know that, like, man, it just takes forever for my muscles to recover to the point where I don't even feel like my next workout is beneficial to me? Or do you want to keep having those concerns of, twisting that ankle or twisting that knee and the ligaments or the connective tissue really giving out so easily? And I'm thinking that that's not what you're looking for. Yeah, so the good news is you can get to the bottom of this. I see this all the time with women in my clinic where we do a 24-hour urine collection where we literally look at 32 different hormones. We look at how your kidneys, your liver, your inflammatory states, your chronic disease risk factors, and how everything is really affecting what's going on with your hormonal system so you can find your balance again. Yeah, so then it really comes down to two things. Do I look at this in a much deeper level? Do I bring balance to my brain, my hypothalamus, my pituitary, and my adrenals? And do I allow my body to really just be in proper function? Do I allow for proper bone and connective tissue turnover? Do I allow for proper muscular integrity? And those are really the things that you can do. And I've seen this again. I've been working with women with menopause for, I think I mentioned, over 25 and a half years before. That's how long I've been in practice, but it's been 21 and a half of those years that I've been specifically working with women and hormones and menopause. And you have the ability to really turn back the clock and feel young again and really kind of escape these potential issues with your skeletal health, with your muscle tissue, with your connective tissue. And it's something again you can do. Yeah, so with that said, hopefully you've gotten some really eye-opening information here for you today. And I also want you to recognize that if you want to be a part of the Menopause Morning group, that just click on the link below this video, and that'll put you on the Menopause Morning list. Because what I do is I typically the night before or the morning of the Menopause Morning, I send out the link to where you can watch this video and also the subject matter of the video, because some subject matters might be a little bit more interesting than others for you, so that way you can get to kind of prioritize which Menopause Morning you're going to be a part of. And also recognize that when I do these, I typically do them live, and if you have questions and comments, you have the opportunity to ask those during the Menopause Morning. And if you happen to be watching the replay of this, by all means, put your question, put your comment on underneath this video, and I'm more than happy to address that personally for you. Now, the other bonus is when you do become a part of the Menopause Morning, when you click on that link, you're also going to get a copy of my book. It's called Fat, Fatigued, and Frustrated. And it's basically how to turn back the clock and feel young again. And this will be an action step guide for you for what I refer to as the fundamentals of health, which is the underlying foundation aspect of what you need to focus on to begin your journey to perfect hormone balance again. Yeah. So with that said, thank you for taking the time out of your busy day to connect with me here to learn more about menopause in a different way. Something that I always refer to as new menopause, which interestingly enough is old menopause, how it used to be back in the days of traditional cultures where women weren't suffering. And that's my passion, and that is a part of my compassion to provide you the information so you don't have to suffer as well. So once again, so you can turn back the clock and feel young again. Have a great day, and I'll see you next Tuesday morning at 8 a.m. Pacific time. Bye bye.